What is attention deficit hyperactivity disorder or ADHD? Attention deficit hyperactivity disorder is a mental disorder that affects the behavior of people with inattention and hyperactivity. It is one of the most common childhood conditions that can persist into adulthood. What are the symptoms of ADHD? Attention deficit hyperactivity disorder, ADHD, is a mental disorder that affects children and adults. There are many symptoms of ADHD, but some of the most common are difficulty staying on task, trouble concentrating, being easily distracted, and having difficulty controlling impulsive behavior. ADHD can lead to problems in school, at home, and in relationships. What causes ADHD? ADHD often runs in families, but it can also be caused by other factors, such as head injury or a genetic mutation. Scientists are still working to determine the exact cause of ADHD, but they believe that it is likely caused by several factors: a deficiency in dopamine production in the brain, an overreliance on adrenaline and norepinephrine, and abnormalities in the structure or function of the prefrontal cortex. What is the prevalence of ADHD? Attention deficit hyperactivity disorder, ADHD, is a disorder that is characterized by problems with attention, hyperactivity, and impulsiveness. ADHD is most commonly diagnosed in children aged 6 to 12, but it can also occur at any age. As an example, it is estimated that ADHD affects about 5% of children in the United States. The prevalence of ADHD in adults is unknown, but it is estimated that about 2% of adults have the disorder. The prevalence of ADHD has been increasing over the past few decades, and it is now considered to be one of the most common psychiatric disorders. What are the different types of ADHD? There are three main types of ADHD: inattentive, hyperactive impulsive, and combined. Inattentive ADHD is the most common type, accounting for around 60% of cases. People with this type typically have trouble paying attention to details and focusing on tasks. They often make careless mistakes and are easily distracted. Hyperactive impulsive ADHD is characterized by a strong tendency to act impulsively. This can lead to problems with completing tasks on time, damaging property, and engaging in risky behaviors. Combined ADHD is a rare variant that combines features of both inattentive and hyperactive impulsive ADHD. How is ADHD diagnosed? The diagnosis of ADHD is usually based on a review of symptoms, which include problems with focus, hyperactivity, and impulsiveness. ADHD may also be accompanied by problems with schoolwork or social interactions. How is ADHD tested? Testing for ADHD is important because it can help diagnose the disorder and determine the best treatment plan. The most common tests are the Diagnostic Interview Schedule for Children Revised, or DISC-R, which measures inattention, the Conners Parent Rating Scale Revised, or CPRSR, which measures hyperactivity and impulsivity, and the Wechsler Adult Intelligence Scale, or WAIS-4, which assesses intelligence. What is adult ADHD? In adults, ADHD may be caused by factors like stress, a chaotic home life, or a lack of education. Adults with ADHD often have trouble concentrating and organizing their thoughts. They also often have problems regulating their emotions. As a result, they can be easily distracted and have trouble following through on tasks. How is ADHD treated? Although there is no one-size-fits-all approach to ADHD treatment, there are a number of effective treatments available. Treatment options typically include medication, therapy, and a combination of the two. Therapy is performed by specialists in different aspects of ADHD treatment, such as learning strategies, behavioral interventions, or medication management. Some people with ADHD also require accommodations in school or work. Therapy can be provided in group settings or one-on-one session. However, a combination of medication and therapy is often the most effective treatment for ADHD. Medication can be either over-the-counter or prescription medications. The most common types of medication used to treat ADHD are stimulants such as Ritalin and Adderall, and non-stimulant medications such as Strattera. In conclusion, ADHD is a real disorder that can have a serious impact on a person's life. However, with the help of medication and therapy, most people with ADHD can manage their symptoms and live normal lives. If you enjoyed the video, please like, subscribe, and share for more videos like this.